Skill that we're going to teach is the dental dam. And
Keep talking, sorry.
okay. Wait, hold on. No. The next thing that we're going to teach is the dental dam. You have the videos. I think I posted the link so you can watch it over and over again, okay? So things that you're going to need are all in the kit. I left some things in there that we won't be using, but we have the clamps. We have the template. This is for the adult, okay? You have scissors, you have cotton pliers, you have the dental dam frame, okay? And it always goes out like the chin goes out, this goes out. Some people put it backwards, and if you put it backwards, it's wrong, okay? So it has to go out like the chin goes out, okay? You have the dental dam hole punch, and you have to know what the sizes are for. So it's 1, 2, 3, 4, 5. Anybody know what the sizes are for?
5 and 6 size of the teeth.
Okay, so what size is number 5?
A molar.
So my instructions said, come prepared for lab. So what's size 5 for?
For a premolar?
Incisor.
No. Size 5 is always for the clamp, because it's the biggest, the anchor tooth. And so you have to read this. If you're not going to be prepared next week, you won't practice, okay? Until I see notes, because the syllabus states you have to come in prepared, okay? So 5 obviously is for the clamp, 4 is for molars, and I have it here. You can take a picture if you want after, but it's in the textbook. 4 is for molars, 3 is for bicuspids and canines, 2 is for maxillary incisors, and size 1 is for mandibular incisors, okay? But 5, regardless on the tooth you're working on, is for the clamp, the anchor tooth, okay? All right, so as always, you always write down. So I'm gonna work on tooth number 30, and I'm gonna give everyone a different tooth. So no one will have the same tooth. Some of you will have maxillaries, some of you will have mandibulars, okay? So my tooth that I'm gonna work on is tooth number 30. What tooth is that? First molar, mandibular. First molar, mandibular, okay? The clamp that I'm gonna use is gonna be, so on here they have it in different languages. Obviously I chose English. So for mandibular molars, it says to use tooth clamp number 7, and it has the color, and they're color coded, okay? So I come over here, I use my clamp forceps, place it in the little holes, and there are videos of this, and I take the clamp out, okay? Close the Fiesta kits. These kits are very expensive, so please do not break or lose anything, because you will be responsible for paying for them, okay? All right, so hole punch, clamps, template. Now, here I have latex and non-latex. I like using the non-latex. Some of my students like using the latex because it's thinner, and they say they can get it through the teeth better. But obviously, if the patient's not allergic to latex, then you can use it. I'm gonna use, and I'll circle it, because I don't want anybody to non-latex, and this is latex, because you can't mix it, okay? All right, so I'm gonna use this one because I've already started it and I wanna be able to finish it. This one's thicker, okay? Some people don't like it because it's thicker, but you know, it's just what it is. All right, so you get your template, you have your, and there's no powder on it, so you line it up correctly. Since I'm doing a mandibular, and it's mandibular patient's left, no, right, right. I'm gonna move it all the way down to the bottom right. I'm gonna use my Sharpie, and I'm gonna go tooth number 31, 30. Okay. Now, why did I go to tooth number 31 if I'm working on tooth number 30?
It's an anchor.
Yes, because you want to go one tooth distal. I believe the textbook says go 1 to 2 teeth distal, but it makes it's easier to put it on the second molar versus the third molar, which can be not, it could be awkward. I mean, sometimes the shape is different. So I'm going to 31, okay? So before I can even do it now, so I already wrote down the tooth, and I marked it. I'm not gonna hole punch anything yet, because what I have to do, and understand this, you will get a 0 right off the bat. You have to prove your work before you do it. Because in the past, so many people have not done it and they do the wrong holes. So basically you're gonna make molar, 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 premolar, premolar, canine, lateral, central, central, lateral, canine, premolar, premolar, molar, molar, molar. Okay, so this is mandibular. And then if I had to do maxillary, molar, 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 premolar, premolar, canine, lateral, central, central, lateral, canine, premolar, premolar, molar, molar, molar. Okay, you have to do your work. Okay, now the tooth that I'm working on is tooth number 30. So I'm gonna put tooth number 30. Tooth number 30 is my tooth, okay? Okay. Now, the midline is right between the centrals, right? If they're correct. All right, now, I'm going to write down the tooth numbers that I have to do. So this one is gonna be, for the anchor, is size what? 5. For the molar, it's size what? 4. For premolars, 3. Canine, 3. Laterals, mandibulars, 1. Centrals, 1 mandibular. Okay, so now I know what hose I'm doing. Okay, all right. So I worked out my information.
So, since I obviously didn't do it, what's number 2 for?
Number 2 is for maxillary incisors. Okay, all right. Now I have it marked, so now I know what hose I need to start. So I'll start with number 1, and I will be asking you next week, how many centimeters is it in between? Because I know some of you didn't read, and you have to read it, okay? So I'm gonna start with the holes. Now that I have them there, I'm gonna start with number 5, okay? And then I have to switch it to 4.
Miss, I have a question. Is it your
Yeah.
preference, like you could start from 1, then work up to 5, or you would want to start from 5 down?
You can do it however you want. I just always start in the back. And then I go to 3, because I had it on 5 back here, so I just started with it. So now I'm gonna do 3 3s. And make sure not to make an extra hole. Oh, and that went off a little bit. Now I go to 1. Now, sometimes people make an extra hole and they try to say, oh, I didn't do it, I didn't do it. Look, it's very obvious if there's an extra hole, okay? Or if you rip it. The whole purpose is isolation, to keep it dry and to prevent anything from going in. So if it rips, you gotta start over, okay? So,
That would be into our second attempt.
yes, ma'am. Okay. And you can see where the holes are. Okay. Right? Now, I have the clamp. In the video, it showed you, they put the clamp on first. Some offices do that. I think Maria at the endodontist, they use the dental dam for everything. I'm not sure how they do it, but they're so efficient with it. I mean, they use it every day, so they're perfectionists on how to do it. Okay, I think the UT, I think they put the clamp in first.
I think they do because I remember
And-
they put the UT.
And to me, that's a little harder, but it works for them. I prefer to put the clamp on with this so that it's already there, and then I just have to pull it over the wings, okay? So I'm gonna show you the way I think is the easiest, okay? And we have our floss, and what's the floss for?
The extra
To do the interproximals and what else?
to
It's a safety net.
Yes, it's a ligature, so it's a safety line, okay? So safety line. So you take the 2 ends together and you do this, right? And all you're gonna do is feed it through here and then bring it through, see? See how I'm doing it? And I'm just gonna do that, see? So it's pretty easy. Okay, so now it has a safety line, a ligature, so that if it accidentally pops off and they aspirate it like that, they can very carefully fish it out because of you don't want to just yank it because it has these points, the jaws. So you're going to have to know the different names of the things about the clamp, and the different parts of the clamp, okay? The different parts of the clamp. Okay,
I don't think I've seen that from health where they put the claws in the clamps.
no? Okay, so now you got to get this through the hole, through number 5, without ripping it, okay?
Does it rip easily?
It depends.
On the latex.
So the latex is thinner. It's easier to go through the interproximal, so a lot of people like it. So if you want to use the latex, you can. You just got to be careful when you pull it over here. This one, it's easy to go over this. It's going to be a little bit more challenging to to do the inversion. Okay. So as I have it already there, then I'm going to pull out the safety line, so it's already out. And we have plenty of dental dam material, so you can come in and practice, make a video. Okay. All right. So now this is how I prefer to go into the mouth. I'm gonna come over here. I'm gonna open it up just so you guys can see it, but then I have to close it, okay? just so you can see me put the clamp on, but then I have to close it in order to do the. Okay. So I have my clamp on, and now I have to work it through the holes. And I'm just doing this so you can kind of see. So I have to carefully, without ripping it, put it on under. So now you know why number 5 has to be. Got it.
So the amount of holes would be on.
Hold on. 5, 4, 3, 3, 3, 1, 1. Okay, go ahead. I'm sorry.
So 1 tooth distal to the tooth you're working on, and then all the way to the midline.
All the way to the midline. And then you have to. So I'm just putting it over the teeth, but you see how it hasn't gone in? Because it's thicker. So then I'm going to have to put it in. What did I do? 1, 2, 3. I did something. 2, 3. How did I get an extra hole? Okay, one to the other tooth.
All you do is just pull it down to get the
Mm-hmm.
teeth right.
Somehow I did an extra tooth. I don't know why.
Second attempt.
Mm-hmm. Exactly. Okay, so now, so obviously I put an extra one. I should have stopped. 1, 2, 3, 1, 2. I should have done 2 hose for number 1. Said I did 3, so I went beyond. Okay. All right. So now you see how it doesn't go through all the way because it's thicker. So I'm going to use my ligature carefully, or get another piece of floss. If you feel, I feel comfortable using this one, but I have enough on here. If you don't feel comfortable, get another piece so you don't knock it off. Okay. Then I'm just gonna make sure I do the inversion and I pull it all the way down. Make sure it goes through. Okay. And I need to make sure that it's nice and tight on all of them. Okay. Because I'll pull it through to make sure each tooth has a nice tight fit. See? You see it?
Mm-hmm.
Okay. And in the back as well, that there's no gaps. Okay. Now I have to close this in order to put the frame, but I'll turn it around so that you guys can see it on this side too. Okay. So the ligature's out. Now the frame. In the past, these bolts, just so you know, are technically there for that. But since patients don't really have that, you can't use that, but you could use it to move it out of the way just to get your frame. And I usually try just to get it on the frame and then I fix it.
So where would that extraness go on a real patient?
I'm sorry?
Like the extra, because you know how you said patients don't have that thing right there? Where would the extraness go?
It's on the frame.
Oh, okay.
Yeah. The company was just putting that there so that we could use it, but we obviously have to teach how to put the frame on. Okay? So, And of course, it's like this so the patient can still breathe. And then this is your wedgette, which basically is a little stopper. So you go through here, and I think the video just leaves it around. I always pop it through the front to really secure it. And then that's how it looks, and I'll flip it so everyone can see it. So, you can see it, and then I'll flip it this way. Okay, now to remove it,
I gotta put y'all on it.
you got it?
Mm-hmm.
Do you want me
I'll
to
send
turn
it
it
to
around?
No, I'll
Okay.
take care of it.
Okay, so to remove it, obviously you want to take the clamp off first. Okay, so you come back here with the clamp remover, you put it in the holes, and then you remove the clamp. Okay. All right. Then you remove the wedgette. So whatever you write in there, whatever you put in there, you must take out. So I need to put one wedgette so that as I take it out, I check it off that I already got it. Okay, and I'm going to be looking to see that you do this because it's a safety factor. Okay, all right, so now it's on here. I always take it off of the frame.
What's the
Take
middle
the
thing?
frame. It's called the dental dam frame.
Dental dam.
Okay, now to remove it, I'm going to open it so you guys can see again, but normally you would do it with the mouth closed. I mean the way it was, but so that you guys can see it. You stretch the cervix right there like that, okay? And all you do is you pull it far enough away where you just snip it, okay? Oh, there you go. See, so you gotta be careful. I've been lucky. Okay, but this, if it's anywhere you want it to tear, it's when you're removing it. Okay, and then you bring it out, and then final thing is inspecting it, making sure you didn't leave anything in there. You go back, you floss out any pieces that you may have left in there. Okay, and then you're done. Okay,